The psychological impact of autism on children and parents. Parents of children with autism spectrum disorder (ASD) often report poor psychological well-being, including a high level of parenting stress and depressive symptoms. Little is known about the extent to which poor parent psychological well-being alters the emotional quality of the parent-child relationship in a context of child ASD. The current study examined the association between actors, one's own and one's partner's level of parenting stress and depressive symptoms, and the emotional quality of the parent-child relationship using a 5-minute speech sample FMSS in 150 families of children with ASD, aged 5 to 12 years, 85.7% male. Mothers and fathers were aged 38.69, SD is equal to 5.62 and 40.76, SD 6.19 respectively. 6% of mothers and 68% of fathers had a college degree. The pervasive and severe deficits often present in children with ASD are associated with a plethora of difficulties in caregivers, including decreased parenting efficacy, increased parenting stress, and an increase in mental and physical health problems compared with parents of both typically developing children and children with other developmental disorders. These parent and family effects reciprocally and negatively impact the diagnosed child and can even serve to diminish the positive effects of intervention. However, most interventions for ASD are evaluated only in terms of child outcomes, ignoring parent and family factors that may have an influence on both the immediate and long-term effects of therapy. Raising a child with an autism spectrum disorder (ASD) can be an overwhelming experience for parents and families. In addition to significant financial strain and time pressures, high rates of divorce and lower overall family well-being highlight the burden that having a child with an ASD can place on families. It cannot be assumed that even significant improvements in the diagnosed child will ameliorate the parent and family distress already present, especially as the time and expense of intervention can add further family disruption. Thus, a new model of intervention evaluation is proposed, which incorporates these factors and better captures the transactional nature of these relationships. Along with effects on parenting self-efficacy and stress, raising a child with an ASD appears to contribute to a general decrease in parental well-being and increase in mental health concerns. Researchers have identified elevated levels of parent mental health problems, particularly depression and anxiety, in comparison with both parents of typically developing children and parents of children with other developmental disabilities. The effect of having a child with ASD on parents and families are like the disorder itself, multifaceted and pervasive. Meeting the high care demands of affected children requires much time, effort, and patience. Caring for children with ASD is challenging due to the severity and chronicity of ASD, their extensive developmental and physical comorbidities, and the difficulties of health services in making widely available the integrated and intensive interventions needed by persons with ASD. The huge impact of having a child with ASD is apparent in both the severity and breadth of parent domains that seem to be influenced. The parents of children with ASD reported higher objective and subjective burden, more frequent psychological distress, lower social support. Mothers reported greater subjective burden than fathers. Structural equation modeling showed that the most consistent positive and negative predictors of objective and subjective burden were ASD symptom, severity, and social support, respectively. Other positive predictors were engagement, distraction and disengagement, coping, intellectual disability, and adaptive functioning. Other negative predictors were spiritual well-being and hardiness. Some effects were indirect through social support and coping strategies. The presence of a child with special needs such as autism spectrum disorder in the household is likely to trigger psychological burden among significant others. Psychological burden often manifests as anxious and catastrophic thinking, as well as various somatic complaints such as breathing difficulties, pounding of the heart, and sweatiness of the palms. These complaints have been encapsulated as symptoms of anxiety disorders.